We have Dr. Michelle Hoffman, Utah Department of Health Deputy Director. From Intermountain Healthcare, Dr. Mark Breesacker, who is the Chief Physician Executive. From Mountain Star Healthcare, Dr. Mike Bauman, who is the Chief Medical Officer. From Steward Healthcare, Dr. Arlen Jarrett, who is the Chief Medical Officer. And from University of Utah Health, Dr. Kensey Graves, who is the Associate Chief Medical Officer for Inpatient Care. So we're going to begin with some brief comments and updates on the situation throughout the state of Utah, and then we're going to open it up for Q&A. As always, please put your questions in the chat. And then immediately following this event, we're going to have Spanish-speaking experts to answer questions in Spanish. So with that, Dr. Hoffman, I'm going to turn it over to you for opening comments.
Good morning and thank you. We really appreciate our partnership with the state's health systems, and this is really a critical time in our COVID-19 pandemic response. I'd like to start off with framing the discussion with some data points. As of June 2021, we've had our third highest monthly caseload growth since the beginning of the pandemic. Currently, Utah has the sixth highest case rate in the nation at 8 per 100,000 people. Since June 1st, COVID-19 cases, percent positivity, and hospitalizations have all increased by at least 75%. This increase in COVID-19 transmission is largely being driven by the Delta variant, which became the predominant SARS-CoV-2 lineage in Utah during this month of June. Currently, we are sequencing about half of all positive cases identified in Utah, and 80% of these variants are Delta. This surge is largely in unvaccinated people who are being infected and hospitalized at 6 times the rate of vaccinated people. Unlike past increases, adults between the ages of 25 and 44 and 45 and 64 currently have the highest case rates, followed by those 15 to 24 and 85 plus. This indicates that most cases are in people who are eligible for the vaccine or who do not have the same level of protection, mostly in our elderly population, from having the vaccine. As I mentioned, these numbers are largely driven by unvaccinated people. The case rate is 6 times higher among unvaccinated people than among vaccinated. That rate is actually likely to be higher due to overrepresentation of breakthrough cases. Similarly, unvaccinated people are 6 times more likely to be hospitalized than vaccinated people. The frustrating part about all of this is that unlike last year, we have all the tools to stop this pandemic in its tracks. The COVID-19 vaccines work. We've made great progress in our vaccination campaign. In fact, we accomplished our goal of getting to 70% of adults with at least 1 dose before Independence Day, as well as our goal to get to greater than 25% of children aged 12 to 15 before Independence Day. But we frankly just need more people to be vaccinated. The highly transmissible nature of the Delta variant has changed the game, and we're clearly seeing this surge related to our unvaccinated populations. We can stop this surge before it gets worse. We can help keep our healthcare systems functioning efficiently, but it's going to require people who have not been vaccinated yet to do so now. Thank you.
Thank you, Dr. Hoffman. Over to you, Dr. Breesacker.
Thank you. Hey, it's really great to be here today with all of you. Michelle, thank you for the update. And, I couldn't agree more about now's the time to act. And I think it's really important for those that are out there who have not been vaccinated to take a moment and take in some of the new information that Dr. Hoffman shared, as well as a few things that I'd like to share. I think most importantly, I'd ask everyone to keep asking questions and keep learning as you work through the personal decision that you are making with respect to whether or not to get the COVID-19 vaccine. So a couple of things that are important to know. We know that immunity from being infected from COVID, which many people were last year, the immune response to that is quite variable among people, and it wanes over time. I know that many people who have been immune are now seeing that immunity wane as the time from their infection has increased. The other thing that we know is that the new variants are much more contagious. And if you were sick from COVID last year, you are at significant risk of getting reinfected again. The other important thing to know with respect to vaccination is that the immune response from vaccination is very predictable amongst all of us. And it is also important to know that that immune response does protect against the variants. So again, keep asking questions and keep learning. In my many years in pediatric practice, as you can imagine, this question came up for all sorts of vaccines. And my consistent advice is let's keep an open mind about these things and continue to learn and continue to resolve the questions that you have, resolve conflicting information that you're getting. Ask your primary care provider, ask your friends and family for their perspectives, and work to resolve any conflicting information that you might have with as many facts as you can gather. I have one other thing that I'd like to bring up, and that is the fact that when I think about our ICU nurses and our teams that are caring for an ever increasing number of patients with COVID these days, they've been at this for over a year. As we all emerged from the pandemic and got back to the new normal lives that we have, they still stayed in our hospitals to care for critically ill people. We're back on the roads. We're having car accidents. We're back hiking in our parks and boating on our reservoirs and walking around. And those activities give us the normal expected summer trauma season. So on top of the increase in COVID, we have an increase in the number of patients we're caring for who have been injured in any variety of manners and fashions. Our nurses, our techs, they are there for all of you. They come to work every day. And when they're caring for people with COVID, we know that many of them chose not to get the vaccine. And it's a sad situation to see someone so sick from that choice. Many of them express that they wish they had gotten vaccinated when they're in that moment. So I can't be more proud of our nurses and our critical care teams and the teams that are on our hospital floors. They are there for all of us across the state. And we really, my ask again, for those of you who are thinking about getting the vaccine, now is the time. There's just no doubt about that. With the variants, with the increase in cases that Dr. Hoffman shared, now is the time to make that decision. Keep being curious, and we are here to help you answer any questions you have about that. That's all. I'll turn it over to the next person.
Thanks, Dr. Briesacker. Dr. Baumann.
Well, good morning, and thank you for the opportunity to speak with you guys again today. I'd like to start with reinforcing that in the Mountain Division, we have 8 hospitals here in Utah, and it's called Mountain Star. We're seeing a slight uptick, but that matches what we look at on the Domo dashboard and other areas. And although that uptick is not huge, we've gone from roughly 20 patients in Utah in May and June to 30 yesterday within our hospitals, and a slight drop today. It is a gradual increase from May up to today. That uptick should get our attention. Although the numbers are smaller than perhaps other systems, it is a definite uptick. We need to pay attention to COVID. We need to not lose our focus. And COVID is an unpredictable disease. We've learned a lot in the last year and a half. And if anything, we know that this can change, and we've seen that with the Delta variant. We need to be very careful that even though it's not the surges that we saw back in December and January, and then February and March, this slight uptick could be the harbinger of a major problem here in Utah if we're not careful. And one of the things that was mentioned earlier is vaccinations. Vaccinations are key. I'm very sympathetic to people who do not want to have a vaccine. There are a lot of emotional challenges around this for some folks, and we're very sympathetic. I'm very sympathetic to that. But if you don't have a specific reason not to get vaccinated, medical or otherwise, I would strongly suggest this is the time to take another look. It is the best effort that we have available now to stop COVID. The information shows that the vaccine works very well against variants, including the Delta variant. There were 2 recent publications in Lancet and Nature that show that, and the durability is good. Something that was mentioned earlier that I'd like to reinforce as well is natural infection is not as important or as durable as getting a vaccine. Currently, I have a family friend in Reno, Nevada, who's been in the hospital twice with 2 separate episodes of COVID, and he has never gotten vaccinated. That's an example of having an infection, it not preventing a future readmission to hospital. So that is really key. The other thing I'd like to emphasize in this group of docs that's on the phone today, we were together last year talking about masking and social distancing. Vaccine's important, but if you're not certain, those simple measures are still important, particularly if you're in a crowd. And if you're not certain, still mask, still keep your social distance. Lastly, I'd like to reemphasize the ICU issue. Right now, our ICUs in our 8 hospitals are showing a gradual increase in the numbers of patients. Some of that is COVID, but a lot of it is the care that's been pent up. Many people have not been able to get the care they wanted or were afraid to get the care that they needed, and that often involves an ICU stay. We're also seeing an uptick in our floor beds being used that are non-ICU. It's important to keep those open for non-COVID patients to get this care. Some of it is indeed new things, new accidents, new heart attacks, new pneumonia, but some of this is people that have been waiting for COVID to wane so they can get their care. It's very important to keep those beds open so that our patients, our family, our friends can get the care that they need. So I'll end with this. If you've not gotten vaccinated, now is the time to think about it again. It's probably the most effective, most important thing we can do to prevent COVID from spreading. And here in Utah, where you've heard that we have a lower vaccination rate, to keep us, our fellow citizens and our friends safe, please go get a vaccine and take this time to rethink about vaccinations.
Thank you, Dr. Bauman. Dr. Jarrett.
Thank you. So I'm Dr. Jarrett. I'm the Chief Medical Officer for the Steward Healthcare System here in Utah. We have 5 hospitals. And I want to thank the Department of Health for putting together this opportunity for us physician leaders from the various health systems to get in front of the public and have one more conversation with everyone about the COVID situation. At Steward, we continue to be able to admit and give excellent care to patients with COVID, just as we have done throughout this entire pandemic. We did have a much needed respite for our nurses and doctors and staff from March to June. Interestingly, though, during those 4 months, we did keep us a very steady and significant census of patients with COVID in the hospitals. We never dropped to 0. But something happened in our system that is unique, it sounds like, compared to what I've heard so far. 2 weeks ago today, we saw the number of COVID patients in our hospitals, the number of patients who were sick with COVID in our 5 hospitals increase by 110% overnight. It more than doubled overnight, and that number has persisted for the past 2 weeks. To say it another way, our hospital capacity, our hospital census of COVID patients is at nearly the same level it was during the worst part of the winter surge. That's a unique phenomenon that we're experiencing, and I have a feeling that we might be an early indicator for what else is going to happen across the state. Currently, our ICUs are, all of our ICUs overall are at 80% capacity. Some hospitals are at 100%. The majority of these patients are not sick with COVID, as has been mentioned. There's a lot of other pent-up need, accidents, surgeries that have been waiting to be done, that are now getting done, and our ICUs are filled up with other patients. We do have the ability to expand, as we did before during the winter surge. And if we need to expand our ICUs, we will do that. But we have a new challenge, and all of the hospital systems are facing these same challenges, in that it seems as though our workforce has been depleted or worn out. We're not seeing as many nurses and technicians and other people apply for positions at all places in the hospital. Housekeeping, dietary, all of the hospitals are struggling right now a bit with finding people who are willing to apply and accept those jobs. Now, we're not in any dire strait, but this is a new challenge that we're facing, and we're coming up with new ways and innovations for how we will address these. As has been mentioned by others, the people that we are seeing sick with COVID in our hospitals are overwhelmingly unvaccinated. And with this new Delta variant that spreads so much faster, it would appear that a choice to stay unvaccinated is very likely a choice to get COVID. Not a matter of if, but when. And so my appeal to the public is that to keep yourself out of the hospital so that we don't have to see you sick in our care, please get vaccinated now. It's never been more important. The end of this pandemic is within our grasp if we will just do our part. And thank you.
Thank you, Dr. Jarrett. Dr. Graves.
Good morning. I'm Kenzie Graves. I'm the Associate Chief Medical Officer for Inpatient Care here at the University of Utah. I want to echo some of the things the other physician leaders have said. The first thing I will start with, though, is painting a picture of what it looks like here at UHealth today. So this morning, we have a handful of open ICU beds. We have a handful of open acute care beds. We have patients boarding in our ED waiting to get in. We are clinically busier than ever as a result of people waiting to get care. So we are seeing that as well. Over the last 2 weeks, our COVID census, patients who have COVID-19 and are sick from that, needing hospitalization, that number of patients has doubled. As we watch our state trends increase, the thing our staff needs the most is for people who are unvaccinated to please get vaccinated now. That are sick, are young. We had a gentleman in our ICU that was under the age of 30. He was here for 3 months. We have the average age of our patients now is between 40 and 55. And so we are seeing a different patient than we saw before. This is especially difficult for our staff because we've watched suffering. We worked additional shifts. We stretched our ICU capacity by 20% over the last year. Now, for our staff to witness suffering that is preventable is heartbreaking for them. Like Dr. Jarrett, our staff is also slim. So we have a lot of open positions that we can't fill. Healthcare is included in the Great Resignation. We continue to provide excellent care, and we implore people to help us by getting the COVID vaccine and helping us protect our ability to continue to do that. I've been on call for the last several days for our hospital and taking screening calls for people admitted with COVID-19. The majority of those have been in their 40s, and they are all unvaccinated. And so here at the University of Utah, we provide excellent care. We want to continue to do that. We need the public's help in getting the vaccine. To do that, please talk with your primary care provider. Go to vaccines.gov. We need your help taking care of our patients.
Thank you, Dr. Graves. We're going to open it up for questions right now, and we already have several in the chat. So the first one, how many breakthrough cases in recent weeks have we seen, and are vaccinated people getting sick? Dr. Hoffman, I'm going to give this question to you.
Thank you, Kathy. Between May 1st and June 25th, 93% of our cases in Utah have been in unvaccinated people. That same number holds for the number of hospitalizations. 93% of hospitalizations have been in unvaccinated people, and 95% of our deaths have been in unvaccinated people.
Does anyone else want to add to that, any of our hospital leaders? Dr. Bauman.
So we pulled information from one of our hospitals, and it's just to reflect on this again. 33 out of 35 of our patients in June at Ogden Regional Hospital were unvaccinated. One patient was a breakthrough, and the other patient had only gotten 1 of 2 doses. So it just reinforces that being vaccinated is really a key preventative to being hospitalized and potentially dying. So that's just one of our facilities that I got the most up-to-date data yesterday morning. So again, reinforce that we need to be vaccinated, and it will help prevent hospitalizations when we really need our beds for other things as well. It's important to take care of our COVID patients, but we have other patients to care for as well.
Okay, and we have a question about the Israel study that came out yesterday saying that the Pfizer vaccine, the efficacy has dropped to 64% against the Delta variant. Dr. Hoffman, I'm going to go back to you again on this one. Can you comment on that?
Certainly. So anytime a new data point comes out, we want to reach to that, and we have to be very careful around the timing of those messages. So the Israel data is only preliminary at this stage. It was gathered between June 6th and early July, so 1 month's worth of data. And so it's really too early to precisely assess the effectiveness against the Delta variant. We really have to look collectively across all data and not really hone in on one specific early figure coming from one country. This is a global problem. We have many people who are receiving the Pfizer vaccine, and we're increasingly becoming better aware of the impact that will have on the Delta variant. The reassuring point is that the vaccine manufacturers are well aware of these risks and are actively working on addressing that through booster doses. And so while we haven't yet made any movement on deciding whether we need to proceed with boost doses, it's a wait and see still. But certainly if this persists and we continue to see lower efficacy, we'll have to move in that direction.
Thanks, Dr. Hoffman. Another question from Sean Means. Governor Cox has said he does not intend to bring back mask mandates or business restrictions, and the legislature has shut down talk of incentives for people getting the vaccine. Programs are in place to encourage the hesitant to get vaccinated with varying results. What policy changes would you all, as hospital leaders, recommend to fight against this surge? Dr. Briesacker, I'm going to go to you on this.
I feel that this is such an important personal policy type of decision, and the facts are as we've outlaid them. The vaccine it works, it's effective, it's safe, and this is about everyone making that decision and continuing to work to understand the pros and cons for them personally, and continually moving towards resolving the questions they have, and then going and getting vaccinated. You know, the policy perspective with respect to things we did before, those were necessary because we did not have a vaccine. We have a definitive treatment, just like we have vaccines for measles and for whooping cough and for chicken pox and all the other things, tetanus. These are all things that we all get vaccinated for. And we do it for the simple reason that the risk of the disease is so high and the risk of severe complications is so high that it's worth it to get vaccinated. COVID-19 is the same way. So the policy here is simply let's get vaccinated at the highest level possible for our state.
Thank you, Dr. Briesacker. Dr. Graves, anything that you'd like to add to that?
Yeah, that's a great question. And so as a physician, I feel like for me to advise policy really isn't where I belong, but I will talk about what I know scientifically and what I have seen. What I have seen is that the majority of people we're admitting that are very sick are unvaccinated. We have a definitive tool to end the pandemic. We have a definitive tool to take care of each other, to keep each other safe, and that is the vaccine. I know there are people out there that are worried about that and worried about safety. We've seen millions of people be vaccinated over several months. The vaccines are very safe and very effective, and we are not seeing admissions at the same frequency as we are with people who have gotten the vaccines as those who have not. We're admitting people who have not been vaccinated. So I want to encourage everyone to get the vaccine. If you have not been vaccinated, I do think it's important to recognize that the Delta variant is transmissible and it is likely to land you in the hospital. And that I think is worth avoiding. So masking and social distancing is important if you're unvaccinated, but the more definitive thing to do is to get the vaccine.
Thanks, Dr. Graves. Dr. Jarrett, do you want to add anything to this?
You bet, Kathy. Thank you. So I'll just add, I think that the time has come we're past the point of mask mandates and social distancing mandates as we've seen. I think that's behind us. But I think there are still ways in which we can develop policies that can help us move the vaccination program forward. I think there are still plenty of barriers that are keeping those individuals who really might get a vaccine from getting it. Now, we know that there are some individuals who are just never going to choose to get a vaccine. We can continue to educate and put information in front of them, but there are plenty of people, I think, still who would get vaccinated if the barriers weren't there. And we heard President Biden, I think, mention something in his plan about taking the vaccine to the people. And I think that's something that we could do with policy. We could do plenty of things to take down barriers. Some individuals maybe don't have the ability to take time to get off of work, or they don't have transportation, or they just don't understand where or how to go to get a vaccine. We're doing things inside of our hospitals now that will start to search for patients that haven't been vaccinated and offer them an opportunity to be vaccinated while they're in the hospital. We're also trying to stretch that out and find out if their family members or visitors who are with them have been vaccinated or not, and then find ways in which we can offer them, taking down again the barriers that kept them from getting vaccinated in the first place. I think that's a policy direction that we could take.
Thank you, Dr. Jarrett. Dr. Hoffman, a point of clarification for you. You mentioned overrepresentation of breakthrough cases. Is that just because people who have been vaccinated are more likely to get tested and report those breakthrough cases than people who haven't been vaccinated?
Yeah, Kathy, that's exactly right. We have seen these patterns in our surveillance data, survey data of the general public. The people most likely to wear masks still are those who've been vaccinated. And similarly, the people who are most likely to go and get tested when they have concerns over an exposure or symptoms of COVID-19 are more likely to be tested.
Thanks, Dr. Hoffman. A question here, is there a need coming for the state to mandate masks again, enforce social distancing, et cetera, again? What will it take to reach that point? Do you want to start, Dr. Hoffman, and then maybe we'll ask our other hospital leaders?
I think our other speakers has addressed this really well. We are in a very different place with an effective measure, public health measure that is universally available to all Utahns over age 12 and older. And it's a matter of getting vaccine to as many people as possible and those personal choices. Of course, as Dr. Graves mentioned, any individual who remains unvaccinated, we have another very effective public health intervention, and that's universal masking that we used to get through the worst stages of our pandemic. Very effective. It kept our children in schools. It works. And so every unvaccinated person should continue to be masking.
Thanks, Dr. Hoffman. Dr. Bauman, we didn't hear from you on this. Do you have any thoughts on this topic?
So I think it's been covered well, as was mentioned, that at this point, vaccinations are probably the most important and most effective and safe way to prevent COVID. For those that are unvaccinated, I think there's still an important role for masking and social distancing. Also, if you're just not certain, as I mentioned when I made my opening remarks, masking and social distancing are always an option for anyone to choose. But moving into that as a policy again, I think more important, our focus should be on getting people vaccinated. And frankly, kudos to Arlen and his comments around breaking down barriers. I think that's a key thing that we could move into here in Utah, is the ability to look at what policies could potentially help break down barriers.
Thank you, Dr. Bauman. A question here, are there other patterns you're pulling out, whether it be mobility related or other surveillance data about where and among which groups the virus is surging right now in the state? Dr. Hoffman, do you want to take that one, and then we'll give it to a few other hospital leaders?
One of the areas that we've really tried to get some more granular data this past week is around the age demographic. We've talked about low rates of vaccine breakthrough infections, but I think it's really important to note that there's differences in our immune response based on age. And among the unvaccinated, we see differences. So from the 12 to 18-year-old age group, those hospitalized, 98.7% are unvaccinated. But if you get into the older age groups, those highest at risk of death and disease from COVID-19, our 70 to 79-year-olds are 82.2% unvaccinated in the hospital. That means they're having far more breakthrough cases in our elderly. Same for our 80 and older. 76.5% of those hospitalized are unvaccinated. The remainder are vaccinated. So we are seeing breakthrough infections in our older populations at a higher rate than we are on average across our population. And that's really important. We started in this pandemic recognizing that the most at risk were and most vulnerable were our elderly. Those individuals still remain our most at risk and our most vulnerable, even in the presence of vaccinations. And I know that many people have had loved ones living in nursing homes throughout the state, experiencing the devastation of COVID-19. Just think about our loved ones and the risk that this surge is posing to all of them.
Dr. Briesacker, do you want to weigh in on this as one of the larger healthcare systems in the state? What kinds of trends are you seeing related to patients with the Delta variant?
Yeah, thank you. We're seeing, as with other systems, the same steady increase in cases across the entire system. Our ICUs down in St. George have been full for most of the past couple of weeks. It was disappointing to get on the call with my colleagues a week or so ago to reinstitute some of our processes around load leveling, the transfer of patients between systems as we all work to manage our ICU capacity. And in several of our hospitals, we're looking at decisions to reinvoke some of the waivers around different types of care that were present during the height of the pandemic, because we are approaching that level of care again. The patients we're caring for are younger. They are, as with every other, the most important trend here is this recurring theme of the people that are in the hospital have not been vaccinated. That by far is the message. That's the trend to make note of here. And again, it's just when it happens to you or to someone it's just so personal and so meaningful. I encourage everyone to just reflect and think about what they experienced when someone close to them got really sick or died from COVID, and what that might mean for them if it was right within their family, and incorporate that into your decision making. It's just the most important step any of us could take for each other and for our entire community.
Dr. Graves, do you want to comment briefly on trends we're seeing among hospitalized patients?
Yeah, I agree. So we are seeing the majority of our patients with COVID-19 are unvaccinated. So in this past several months, I believe we've seen maybe one or two that are breakthrough cases, but the vast majority are unvaccinated. That includes people from rural parts of Utah. The one thing I will point out, and Dr. Hoffman can add, is vaccine rates across Utah are quite variable. And so we have areas of high vaccination rates like Summit County and low vaccination rates, and often we see the people from those rural areas coming here and needing critical care.
Thanks, Dr. Graves. And I'm going to get to a few more questions here. I want to be mindful of shifting over to our Spanish language portion of this press conference, but a few more questions here. Dr. Hoffman, I think these might be best for you. So just following up what you said, so is there some type of behavior that's contributing to the spread right now among the unvaccinated, such as not wearing masks? And also, is it fair to say that a spread among the unvaccinated young people is driving breakthrough infections among those who are already vaccinated? Can you comment on that?
Sure. So certainly we have a behavioral risk factor survey that we do, and we do know that those who are unvaccinated are also the most likely to be unmasked. So definitely our behaviors do drive the breakthrough cases. As Dr. Graves mentioned, choices around choosing to be vaccinated, differential rates of that in geographic areas across the state. We know that individuals in the hospital are vastly unvaccinated, and it is logical that they would be coming from places where they have lower uptake rates of the vaccine overall. As far as fairness, I mean, so there's individual responsibility, and then there's a sense of community altruism and our ability to collectively come together to do the right things. We know what tools are required. We know what it takes to slow the spread and stop the spread of COVID-19. Many places are doing that perfectly. We've got our nursing homes throughout the state. They're continuing to have very aggressive infection control measures in place, universal masking and the like. People know what the right things are to do. We have to call upon all Utahns to continue to do that. It isn't fair that a subset of our population is leading to surges in our disease, but we have to have a community spirit and altruism that I know Utah has. We come together to get things done, and this is one of those times that we need to do so.
And then the other part of that question is transmission among the unvaccinated driving breakthrough infections among those who are vaccinated. Do we have any data on that?
So I don't think we can get that granular other than the logical assumptions that people who remain unvaccinated are those who are getting infected at a higher degree by like 95% plus. And they're also the ones likely to be in the hospital and experience death. And so, yeah, it is fair to say that.
Okay, and again, wanting to be mindful to shift over to Spanish here. So we're just going to do a few more questions. I'm going to do rapid fire here. We have a question about, from Sean Means, do the hospitals you represent require employees to be vaccinated against COVID-19? And do we require employees to get vaccinated against measles, other whooping cough, other things like that? I'm going to go to everybody and just rapid fire. Dr. Breesacher.
We do not require the COVID vaccine at this time. We continually evaluate it. We do require vaccination for measles and tetanus and other communicable diseases.
Dr. Bauman.
We do not require COVID vaccines at this point in time. And I'll shift the second part of the question slightly. We are very interested in having people get vaccinated for flu, but we also don't require flu at this point in time, but do require employees to be masked if they have not been vaccinated for flu.
Dr. Jarrett.
We do not require COVID vaccination for our employees at this time, though we strongly encourage it. And we are looking forward to the time when it actually gets official and full approval from the FDA. We do require flu vaccination as well as vaccinations for the other communicable diseases for our employees.
Dr. Graves.
We also do not require COVID vaccination among our staff because it is under emergency use authorization. Like Dr. Jarrett, we closely watch full approval and will likely consider requiring it at that time. We do require vaccination for other diseases, yes. Okay,
and we have two quick questions from Facebook, and I think Dr. Hoffman, you may be the best person for this one. And the question is, I know several people who have received the J&J vaccine and got a second dose of either Moderna or Pfizer. Is this recommended? Is it safe?
Okay, this one's a tricky one. It's again kind of on the cutting edge of where we may be going, and certainly there are some countries that are starting to do some of this. Currently, because we don't have great information yet on Johnson & Johnson, we're really acting off of AstraZeneca efficacy rates. There are some areas in the world doing second doses from AstraZeneca with a Pfizer or Moderna dose or an mRNA vaccine. We do not recommend that currently in the United States. There are not safety concerns posed by that practice, and we are starting to hear of individuals with an interest in wondering about that, but that is not currently a recommendation.
Okay, and we do need to shift over to Spanish, but I want to get to this final question from Facebook. Aren't kids less likely to have severe illness than adults? I have a hard time with the idea of making my kids get an experimental vaccine they don't want. Dr. Hoffman, can you address that very briefly? And then we're going to shift over to Spanish.
Sure. So, I'm a pediatrician by training, and throughout the pandemic. We've minimized the fact that children are less impacted by COVID-19. The fact of the matter is children are impacted by COVID-19. They have, we've had, let me just pull up the data so we have it, correct numbers for all of you. To date in the pandemic, over 80,000, nearly 81,000 Utah children between ages 0 and 18 have gotten COVID-19. 729 of those needed to be hospitalized. 45 of those needed to be in an intensive care unit. And upwards of 100 individuals developed a severe multi-inflammatory syndrome called MIS-C. MIS-C is a serious condition that could lead to death. And in fact, we've had 2 deaths of children in the state of Utah. So it is not a non-issue in children. It is a disease that occurs in children, and it is associated with far higher hospitalization rates on the order of several flu seasons worth of hospitalizations for children with COVID-19 as compared to the flu. This is a serious disease for children as well. Thank you.
Thanks, Dr. Hoffman. We're going to shift over to the Spanish language portion of this event. So I want to thank everyone for joining us today. I'm going to turn it over to Claudia Chin, who will moderate the Spanish portion of the event. But we're going to need a minute just to transition our speakers. So while we're doing that, I wonder, Dr. Jarrett or Dr. Bauman, if you want to just make any super brief final thoughts.
Sure. Thank you. Yeah. So I appreciate the opportunity to address the public and citizens of Utah with this. You asked a question about any sort of patterns that we might be seeing. Stuart, we don't have large volumes of patients, and so I can't put a lot of statistical value into the patterns that we've seen. But I've seen 2 patterns in our hospitalized patients, especially during the past 2 weeks when we've had our significant surge. One pattern is that the patients have not been as sick, and as many have not required to be in the ICU as we saw earlier. Don't know if that means anything yet, but it's a pattern worth looking at. The second pattern that we've seen, and I'll try to keep this generalized, but our hospitals that are in counties with low vaccination rates seem to be seeing our highest admission rates. And I'll just leave it at those 2 patterns that I've observed, and I'll once again plead with those who haven't been vaccinated to please consider getting it done. Keep yourself safe. Don't choose to get COVID. Choose to stay well. Thank you.
So thank you for the opportunity to speak with you. And I would just reinforce that this is a time to get vaccinated, rethink your opportunity to get vaccinated. It's an opportunity to help prevent you or your family members from becoming ill and becoming hospitalized. As far as patterns, I'll just reemphasize what's been said before. We are seeing our cases primarily in unvaccinated patients. The example I gave earlier from Ogden Regional is a good example of that. So please take this opportunity. Think about being vaccinated. Recognize it can be a bit of an emotional issue if you have concerns. Take the time, talk with your physician, talk with someone, and take another look at becoming vaccinated. Thank you.
Claudia, did you see my comment about translation? Okay, thank you.
Yep, working on that real quick.
Recording stopped.
Once we have that translation, I give Claudia the green light, she'll start. So just give us a second.
Mm-hmm. So a quick question on our end. Are the first speakers supposed to stay for this section using translation, or should we drop off?
Erin, do you want to speak to that a little bit more? Or Jess?
Okay, no, Arlen and Dr. Bauman, you can drop off now. We're going to do it completely in Spanish speaking language. And so thank you for your time, but we'll go ahead and let you go and get on with your day. Thank you.
Está bien, muchas
Thanks very
gracias.
much.
Okay, Mandy, got that over to you.
Perfect. You should see the live on Facebook thing in just 1 second.
Awesome. Thanks.
Recording in progress.
Okay, buenos días a todos que se han unido con nosotros para hablar un poco más acerca de este tema que tenemos sobre el COVID-19. Mi nombre es Claudia y voy a ayudar a moderar esta porción de la conferencia de prensa de español. Hoy estamos unidos por la doctora Michelle Mateu, que es médica de enfermedades infecciosas de Intermountain Healthcare, y el doctor José Rodríguez, que es un profesor del Departamento de Medicina Familiar y Preventiva de la Universidad de Utah. También es AVP de Equidad de Salud, Diversidad e Inclusión. El tema que vamos a hablar acerca de hoy son los casos de COVID y hospitalizaciones en el estado que han aumentado. Y esto está afectando nuestros sistemas de hospitales en todo el estado. Entonces voy a voltear un poco de tiempo a la doctora Mateu y siguiendo sus palabras al doctor Rodríguez, y de ahí vamos a tomar unas preguntas del público y de los reporteros. Por favor, usen la función del chat a los reporteros que se han unido con nosotros hoy día para que podamos mandar esas preguntas a nuestros expertos. Entonces, doctora Mateu, doctor Rodríguez, el tiempo es suyo. Muchas gracias por estar con nosotros hoy y informarnos sobre las variantes.
Buenos días, Claudia. Gracias por tenernos aquí. El día de hoy queremos hablar sobre cómo está evolucionando nuestra epidemia local de COVID-19. Hemos estado viendo un incremento de casos diarios en el estado de Utah. Nos ha puesto al radar en la nación. Somos uno de los lugares en donde los casos están aumentando comparado a otros estados en nuestra nación. También estamos viendo un incremento de hospitalizaciones en todo el estado y en Intermountain también lo hemos visto a través de todo nuestro sistema. Estamos viendo una transición estamos viendo más casos de la variante Delta, definitivamente. Estamos viendo una transición a esta variante siendo la más dominante y estamos viendo un impacto en la salud de nuestra comunidad. Y estamos acá el día de hoy para contestar las preguntas de qué tenemos que hacer, cuáles son los métodos más efectivos para controlar esta situación, siendo la vacunación nuestra herramienta más útil, segura y eficaz para todos.
Pues gracias, realmente es un placer estar aquí con ustedes y gracias por esas palabras, doctora. Después de todo, debemos de recordar dos cosas. Primera cosa es que el estado de Utah tiene una tasa de vacunación que es menos de 40%. Y eso es básicamente 2 de cada 5 han recibido su vacuna. Si hablamos de la población latina, es 11% menos, o sea, 1 de cada 3. Disculpe, sí. 1 de cada 3. En otras palabras, 30% en la población latina, casi 40% en la población del estado. Eso quiere decir que hay menos personas en la población latina que han recibido su vacuna. Encima de eso, nosotros en la población latina realmente representamos 40% de los casos que han sido reportados desde el principio de la pandemia hasta el día de hoy. Y nosotros no somos 40% de la población, solo somos 14%. Así que tenemos más COVID en nuestra población que en la población general y menos vacunación en nuestra población comparado con la población general. Eso quiere decir que hay una buena oportunidad de cambiar el futuro al recibir la vacuna.
Doctor Rodríguez, ¿puede hablar un poco más acerca de por qué nuestra población hispana quizá no se está vacunando y los efectos de eso, no solamente en nuestra comunidad hispana, pero en nuestra comunidad como residentes de Utah?
Claro, voy a empezar con una historia personal. Al venir al trabajo esta mañana, yo estuve hablando con mi mamá, y mi mamá vive en la Florida, y es uno de los estados que tiene, hay 5 estados que están subiendo rápidamente en sus números de casos, de muertes y de enfermedad con COVID. Florida es uno de estos estados, Utah es otro. Y al hablar con ella me dijo que ella no se iba a vacunar. Y eso me dolió el alma porque no sabía yo qué podía decir. Yo quiero ver a mi mamá, quiero abrazarle a mi mamá, pero el miedo que yo tengo, y yo siendo vacunado, es que por algún accidente, si yo soy la persona que le transmito el virus, realmente no podría vivir con esa culpa. Así que he tomado la decisión de no visitar por ahora y eso me duele. La razón que ella da es una razón bien personal. Pero la otra historia que voy a contar es acerca de la mala información que hay. Nosotros como población latina realmente hay muchas organizaciones que tienen como objetivo darnos mala información. Y a veces es a propósito, a veces no es. Así que hablemos de tarjeta de crédito, por ejemplo. Y esto me gusta hablar porque yo tengo tarjeta de crédito. Si yo recibo información de una tarjeta de crédito en español, yo puedo estar seguro que la tasa de interés de esa tarjeta de crédito va a ser mucho más alto que si viene la misma información en inglés. Es solo mala información. Son hábitos que han existido por mucho tiempo. Así que mala información es la primera cosa que realmente causa problemas para nosotros como pueblo latino. Segunda cosa que causa problemas es que nosotros como pueblo a veces no tenemos acceso a las vacunas. En la porción de inglés hablaron muchos médicos acerca de eliminar barreras para que recibamos la vacuna. En el estado de Utah realmente estamos haciendo un buen trabajo porque la gente puede ir a las farmacias y hay farmacias que están abiertas 9, 10 de la noche, pueden ir a urgencias a recibir las vacunas, pueden ir a su doctora principal o su doctora de cabecera para recibir las vacunas en casi todos los sistemas de salud que hay en este estado. Así que debemos de recordar que hay barreras y debemos de tratar de eliminar esas barreras. La última cosa es esta, y es que nosotros somos en nuestra mayoría empleados esenciales. Así que a veces no hay tiempo libre para tomar la vacuna. A veces no hay tiempo libre para recibir cuidado de salud, porque el tiempo que estamos libres, la clínica está cerrada. Debemos de recordar que al igual que las pruebas de COVID, las vacunas de COVID están gratis y disponibles gratis para todas las personas que quieran recibir. Y mi urgencia en hablar con ustedes es decirle que tenemos solo 2 opciones. La primera opción es vacunarnos y no enfermar a las personas que queremos. La otra opción es no vacunarnos y realmente vivir como vivíamos hace un año en la pandemia. Mantener la distancia, lavar las manos cada rato, siempre usar mascarillas donde quiera que vayamos. Así que debemos de escoger, ¿queremos volver a ese tiempo? Porque eso es la conclusión lógica de no recibir la vacuna.
Gracias, doctor, y gracias por compartir su sus experiencias personales que tienen. Doctor Mateo, ¿puede hablar un poco más acerca de la variante de Delta y cómo está afectando a las clínicas y los hospitales de Intermountain?
Claro, bueno, la variante Delta, como hemos visto, se ha convertido en la variante predominante a nivel mundial, quisiera decir yo, y localmente en Utah sí hemos visto que hemos transicionado a tener la variante Delta como la variante más dominante. La variante Delta es más transmisible y nos preocupa que puede conferir una enfermedad más severa y más grave a aquellos que están siendo vulnerables. Entonces, hasta el momento, la evidencia sugiere que nuestra vacunación es efectiva contra las variantes y en particular la variante Delta. Entonces, a pesar que tenemos una amenaza contra nuestra comunidad, tenemos una herramienta que funciona, que la tenemos que utilizar. Estamos viendo un incremento de hospitalizados, pero la mayoría de estas personas son personas que no han sido vacunadas. Entonces, es importante utilizar las herramientas que tenemos y como el doctor Rodríguez bien lo dijo, o nos vacunamos y podemos estar con paz, tranquilidad, que estamos protegidos, que si nos llegáramos a infectar, pues lo más probable es que tengamos una enfermedad mucho más leve de lo que tendríamos si no. La probabilidad que transmitamos también, hay un poco de evidencia que es menor que alguien que no está vacunado. Y la contraria es, ¿verdad?, continuar usando las otras medidas de protección, mascarilla, aislarnos, no poder compartir, cosas que son mucho más difíciles de manejar. Entonces, sí, en conclusión, la variante Delta pues, nos amenaza, pero tenemos las herramientas que necesitamos para estar protegidos y la tenemos ampliamente disponible en Utah. Es impresionante a donde voy. Yo miro, véngase a vacunar, y siento que es como una súplica para que todos vayamos a vacunarnos. Está altamente disponible para todos, sin importar el estatus migratorio, sin importar quién es la persona, y utilicémosla.
Muchas gracias.
Sí.
Iba a volver el tiempo a usted, doctor. Por favor.
La única cosa que añadiría es esta, y es que 60% de los que vivimos en este estado no hemos recibido la vacuna. Así que por nuestra mayoría estamos sin vacuna y 70% de la población latina está sin vacuna. Las personas que han sido hospitalizadas, 95% de las personas que mueren son personas que no tienen vacuna. Y de las personas que son hospitalizadas, es 93% que no tienen vacuna. Así que es una protección fácil e increíble. Y le invitamos a que traten de poner las dudas al lado y que pensemos en el sacrificio que debemos de hacer por nuestros seres queridos. Porque después de todo, si yo me enfermo con COVID, soy yo. Pero si mi esposa, mis hijos, mi mamá se enferma con COVID, eso sería 1000 veces peor para mí.
Y yo también quisiera solo añadir, por último, que no podemos predecir cómo nos va a afectar el COVID. Hay personas que les ha ido muy bien, que lo pasan como que sin nada, pero hay personas que han sufrido muchísimo y si no se mueren, pues quedan con muchas secuelas. Y lo más triste es que, por ejemplo, yo, una persona joven, no tengo comorbilidades, si me infecto me va bien, pero infecté a una persona más vulnerable que yo y a esa persona le puede ir muy mal. Y entonces no se puede predecir cómo nos va a afectar el COVID a cada quien. Ahora, sí sabemos cómo nos puede llegar a afectar la vacunación, qué efectos adversos tiene, cuáles son las cosas que tenemos que tener alerta de síntomas, de efectos adversos de la vacunación. Podemos tomar una decisión informada sobre los riesgos que vamos a asumir al vacunarnos. Y yo entiendo muy bien la preocupación de de la incertidumbre del tema de la vacunación, pero para mí hay mucho más preocupación e incertidumbre de los efectos adversos que me puede causar COVID en mi vida que la vacunación, que ya tengo mucha certeza que es segura y eficaz. Entonces, utilicémosla, prevengamos la enfermedad severa y las secuelas a largo plazo.
¿Nos pueden contar un poco más sobre los efectos de esta variante de Delta en las diferentes edades? Por ejemplo, ¿está afectando más a los jóvenes o lo está afectando más a los adultos, a los mayores de edad? ¿Qué están notando ustedes dos o qué han visto?
Bueno, para comenzar, creo que no necesariamente es efectos en sí de la variante Delta. Depende mucho del comportamiento en cierto grupo comunitario, la tasa de vacunación en cierto grupo comunitario. Lo que sí puedo decir es definitivamente hemos visto un incremento de hospitalizaciones. Estamos viendo nuevamente un incremento de hospitalizaciones en las personas de edad mayor, de 60 para arriba. Esto lo pueden ver ustedes en las tendencias en la página del Departamento de Salud, cómo va cambiando la tasa de hospitalizaciones de diferentes grupos de edad. Hemos visto en general un incremento de casos en todos los grupos de edad, pero hemos visto más hospitalizaciones en estas personas de edad avanzada, que por supuesto son las más vulnerables, ¿verdad?
Sí, después de todo, variante Delta es más transmisible. Ahora, eso quiere decir que es más contagioso. Y el problema es que es el variante predominante en este estado y en este país. Así que tenemos que tener cuidado. Pero otra vez le digo, la vacuna tiene una protección fenomenal en contra de las variaciones y de los variantes. Así que realmente es el único remedio. La invitación aquí es que tenemos en nuestro poder la habilidad de terminar con la pandemia. Pero en 40% de las personas del estado que tienen vacuna y 30% de la población latina, eso no es suficiente. Necesitamos 70%. Y sí lo podemos hacer. Nadie quiere volver a usar mascarillas siempre y no poder ver a la familia. Pero ese es el futuro si no nos cuidamos.
Y añadiendo a ese punto, si no llegamos a controlar esto utilizando nuestra estrategia de vacunación y la transmisión continúa, el virus continúa mutando y se continúa volviendo más eficiente en todo sentido, en transmisión, en enfermedad severa. Entonces, ese es otro punto importante de por qué es importante una vacunación colectiva. O sea, yo me quiero proteger a mí, pero más que todo quiero que mi comunidad se proteja para prevenir que nuestros niños regresen a los colegios, que nuestra gente mayor no se puede vacunar por alguna razón y hay gente a la cual la vacuna no le va a ser tan eficaz como a otras. Por ejemplo, personas que tienen cáncer, personas con un sistema inmune suprimido. La única forma de proteger a esta gente es que toda la gente alrededor de esa persona vulnerable se vacune. Entonces es como una capa de protección alrededor de esta gente y eso es lo que nosotros llamamos inmunidad de rebaño, ¿verdad? Y yo me refiero a nosotros como individuos en la comunidad. Tenemos la responsabilidad de contribuir a la protección de estas otras personas vulnerables y al bienestar de la comunidad, porque al final de cuentas los seres humanos vivimos en comunidad por una razón y queremos todos contribuir al bienestar.
De acuerdo, no tengo nada para añadir.
Está bien, acá tenemos algunas preguntas para ustedes dos. Sebastián con Univisión dice, el gobernador anunció ayer que el 70% de adultos ya se encuentran vacunados en el estado. ¿Este porcentaje no es suficiente? ¿Qué porcentaje sería una cantidad segura
de gente vacunada. Doctor Rodríguez, si usaría primero.
Claro, ¿podría decirme cuál es el porcentaje que anunció?
Dijo 70% de adultos.
¿70% del estado está vacunado?
Ajá.
O sea, eso es, no es que están vacunados, es que han recibido por lo menos uno. La vacunación completa es mucho menos que eso. Y sabemos que la vacunación completa es lo que es necesario para prevenir casos. Desafortunadamente conozco amigos, vecinos, familiares que han recibido una vacuna y después se volvieron a enfermar porque pensaron que una vacuna era suficiente. Así que una vacuna es suficiente en un solo caso y es si esa vacuna es de Johnson & Johnson. Las otras vacunas todas son de 2 administraciones y si solo recibe uno no es suficiente y 70% es el número que han recibido solo uno, no lo que han recibido vacunación completa. Así que cuando lleguemos a 70%, y realmente es más, hay personas que dicen que es hasta 85% que necesitamos para protegernos en esa inmunidad colectiva o inmunidad de rebaño. Pero son las 2 vacunas. Una vacuna no es suficiente.
Correcto. Y también es importante que tenemos que hablar más específicamente sobre las tasas de vacunación en los grupos específicos, ¿verdad? En dónde me muevo yo en mi comunidad, como bien lo dijo el doctor Rodríguez, que en nuestra población hispana la tasa de vacunación es mucho menor y eso es, ¿verdad? En los círculos en los que nosotros nos movemos. Quiere decir que las personas alrededor nuestra, pues la tasa de vacunación ahí es menor o en cierta county o ¿verdad? Hay que verlo a nivel bien específico y cómo nos afecta como individuos. Y también estoy de acuerdo que 70 no es un número, es lo que necesita la comunidad y eso no lo vamos a saber hasta que aumentemos los números de vacunación y miremos los cambios en el número de casos y en el número de hospitalizaciones. Vamos a saber cuándo es suficiente y creo que para mí personalmente suficiente va a ser hasta que todas las personas elegibles estén vacunadas siempre y cuando sea seguro para ellos y la mayoría de personas es seguro para ellos con muy pocas excepciones y para mí esa es la meta, es vacunar a todos los elegibles y candidatos de vacuna.
De acuerdo.
Gracias. Marco Muñoz pregunta, ¿cuál es el porcentaje de personas con la nueva variante Delta en Utah?
Doctor Rodríguez, si usted quiere comentar, yo tengo la página del Departamento de Salud aquí en donde puedo rápidamente mostrarles cómo ha predominado la variante Delta. Es básicamente la variante dominante, o sea, en la última estadística, la variante Delta abarca el 79.8% de los casos y con la variante Alfa, que es la B117, siendo ahora la de menor cantidad, 10%. Entonces, definitivamente está incrementando rápidamente y lo va a seguir haciendo, va a seguir aumentando. Pero también recalcar que variante Delta no significa que ya llegamos al tope de las variantes. El virus muta y va a seguir mutando mientras siga habiendo transmisión. Entonces, mientras más transmisión haya, mientras más eficiente es el virus para transmitir, más transmisión, más mutaciones y eventualmente vamos a ver una variante que es mucho más eficaz para transmisión y enfermedad severa.
Otra vez volvemos a la vacunación. La vacunación realmente protege en contra de todos los variantes y entonces si tenemos la mayoría de las personas, y yo estoy de acuerdo, realmente necesitamos 100% si se puede, o casi 100%, porque eso sí va a proteger. Y si el virus no tiene comida, muere. Y la vacuna es la única manera de quitarle la comida al virus.
Gracias. Alfredo pidió que si por favor puede dar un mensaje a nuestra comunidad que no se ha vacunado, de pensar un poco más y tomar la decisión correcta cuál es el ser vacunado. Puede hablar un poco acerca de eso, pero también a las diferentes edades, ¿no? Grupos de edades. Por ejemplo, a nuestros jóvenes y después nuestros adultos y nuestros mayores de edad. Doctora Mateus, si usted puede empezar, por favor.
Bueno, tenemos básicamente dos tipos de vacuna disponibles en el estado de Utah, la de Johnson & Johnson y las de mRNA, que son Pfizer y Moderna. Cada vacuna tiene su propio espectro de efectos adversos en diferentes grupos de edad, ¿verdad? Por ejemplo, en las vacunas de mRNA hemos hablado sobre la posibilidad de miocarditis, miopericarditis en los jóvenes, adolescentes y grupos menores, y a medida que va siendo menor la edad, pues hemos visto incremento de incidencia ahí. En el caso de Johnson & Johnson hemos hablado sobre la coagulopatía, la trombosis con trombocitopenia, y esto lo hemos visto más en un grupo de mujeres, en rango de edad, adultas jóvenes, pero lo hemos visto menos en hombres y menos en personas de edad mayor en general. Entonces, y también hay que hablar sobre, es válido tener estas preocupaciones de ponerse una vacuna que contiene cierto riesgo, es válido tener esa preocupación, es importante tener la preocupación, ¿verdad? Pero no hay que dejarlo ahí, hay que informarse. Hay que informarse bien sobre los riesgos y beneficios de cada una de estas vacunas para la persona, ¿verdad? Ya sea su género o su edad, cuál es el contexto de la vacunación. Y hay que hay que buscar la fuente de información que más me haga sentido, ¿verdad? Y obviamente fuente de información fidedigna, la página de la CDC, la página del Departamento de Salud, vacunas.gov, que tiene muy buena información. Hay que hablar con nuestros profesionales de salud, a quien la persona le tiene confianza. ¿Verdad? Buscar la forma de poder tomar esa decisión informada. Hay muchas fuentes de información y como lo dijo el doctor Rodríguez al principio, las redes sociales han venido a invadirnos de información muy mala y ha sido la cruz de toda esta pandemia. Y, ¿verdad? Entonces estoy hablando de tomar decisiones no de mi amigo, no de mi red social, sino de una persona que tenga el conocimiento necesario para que yo pueda agarrar esa información y tomar mi decisión. Y una persona que me conozca o que conozca a la persona que está pensando en vacunarse y tomar en consideración esos concerns o esas preocupaciones. Eso se llama decisión compartida, cuando el proveedor de salud está dando su recomendación basada en la ciencia, pero también estamos tomando en contexto la situación del individuo, ¿verdad? Eso es una decisión compartida. Es muy importante que hagamos eso. Yo creo que a medida que entendamos más las razones de por qué la gente no se vacuna y podamos ayudar a la gente en esa razón, vamos a lograr que la gente se vacune más.
Después de todo, tengo personas muy cercanas de mí que realmente han decidido no vacunarse. Y es una decisión que me duele. Y cada vez que hablo con ellos, mi trabajo es reconocer que sus razones son válidas. Y eso es lo que hago. Realmente nosotros como sistemas de salud no tenemos muy buena reputación con la población latina. Y en el pasado hemos cometido crímenes en contra de gente latina, de personas de ascendencia africana y de muchas personas. Y realmente eso está en el pasado. En este caso, les digo que la vacuna no es un experimento. Cientos de millones de personas han recibido la vacuna y no han tenido ningún problema. En el caso de personas que han recibido la vacuna y han tenido problemas, eso es 1 o 2 de cada millón. O sea, más probable es que yo me gane la lotería en el estado de Utah y el estado de Utah no tiene lotería. Así que recordemos que las personas sí merecen respeto, compasión y amor. Y la verdad es que las personas, cuando estamos hablando del beneficio para ellos mismos, eso no es una motivación para muchas personas. Pero cuando hablamos de cómo es que pueden proteger a sus mamás, sus abuelas, sus hijas, eso sí es motivación. Así que hablemos de la familia. Yo quiero ir a abrazar a mi mamá, pero el miedo que tengo de infectarla es grandísima y no podría vivir con eso. Así que espero que un día ella se vacune y espero que un día pueda verla. Pero amor y respeto es importante porque, como decía mi mamá, puede conseguir más abejitas con miel que con vinagre. Así que hay que amar lo suficiente para que hagan la decisión.
Muchas gracias, doctor. Gracias por compartir esas palabras. Tenemos una pregunta más y ahí terminaremos. Marco Muñoz nos dice, recomienda que así que estén vacunados tomen precauciones por esta nueva variante y hacerse los exámenes. Si tienen síntomas, muchos piensan que porque están vacunados no se pueden contagiar. También seguir usando las máscaras o distanciamiento en personas vacunadas.
Sí, es exactamente la recomendación. Como se recordarán de lo que hemos hablado, las vacunas no son 100% perfectas, ¿verdad? Tienen sus limitantes. Habrán personas que sí tendrán un contagio, una infección, a pesar de haber sido vacunados. Lo más probable es que esta persona tenga una enfermedad leve y no una enfermedad severa como lo hubiera tenido si no se hubiera vacunado. Entonces, sí puede ocurrir un contagio luego de vacunación, definitivamente que sí. Y por ende es importante que si tenemos síntomas nos volvamos a hacer la prueba. Y también reconocer que aunque ahora sepamos que la vacuna es eficaz para cierta variante, puede surgir una variante en cualquier momento. Entonces, hay que seguir haciéndose las pruebas y estar seguros que no vamos a ser transmisibles hacia nadie más. Y si en caso fuéramos positivos, aislarnos para no continuar la cadena de contagio. Y también, yo sí pienso que la mascarilla debería de seguir siendo utilizada en situaciones en donde pensamos que estamos en riesgo. Por ejemplo, al ir al supermercado, que es un espacio cerrado en donde nadie más está usando mascarillas. Asumimos que si la tasa de vacunación a nivel comunitario es 50%, que la gente que está en el supermercado representa una muestra de la población, por lo cual solo 50% de la gente está vacunada. Entonces yo escojo usar mascarilla cuando voy al supermercado y cuando estoy en situaciones en donde me siento que no puedo mantener mi distancia, que no hay buena ventilación, inclusive espacios abiertos en donde hay mucha congestión de personas, sigo usando mi mascarilla y entonces podemos determinar esos momentos de riesgo. Y creo que también para mí es como respeto hacia los demás. Si nadie sabe en algún cierto lugar si yo estoy vacunada o no. Entonces a mí me hace más sentido que yo tenga mi mascarilla para demostrar que respeto a las personas que están alrededor y que apoyo ¿verdad? Que tengo ese sentido comunitario. Para mí eso es importante demostrarlo, ¿verdad? Y o sea, la pandemia sigue, los casos incrementan. Estamos aprendiendo sobre las vacunas, cómo van cuál va a ser el performance, cómo van cuál va a ser su eficacia en los siguientes meses. Estamos aprendiendo todavía mucho. Esto no deja de cambiar y tenemos que utilizar todas las herramientas que están en nuestras manos para disminuir los contagios, y eso incluye distanciamiento, mascarilla cuando es importante, etcétera. Entonces, sigamos haciéndolo.
Y de acuerdo, realmente han hablado de que las personas que son más propensas a usar mascarillas en el estado de Utah son las mismas personas que han recibido la vacuna. Interesante. Pero la verdad del caso es que usar mascarillas, mantener distancia, lavarse las manos siempre, buscar cuidado de salud cuando se necesita es sumamente importante y son herramientas que todavía están vigentes para utilizar en contra de esta pandemia. No se ha acabado y a menos que 100% de nosotros estemos vacunados, va a durar más tiempo.
Pues muchas gracias, doctora y doctor, por su tiempo y por toda la información que nos ha dado. Es un buen mensaje de urgir a los miembros de nuestra comunidad hispana que hagan su parte y hagan todo lo que puedan para estar saludables y mantener a nuestra comunidad saludable también. Esto va a concluir nuestra porción de español, esta conferencia de prensa, y les deseamos un buen día. Gracias.
Gracias, Claudia.
Gracias, un gusto verlos.
Igualmente. This concludes our Spanish portion of the press conference. Thanks, everyone.
Recording stopped.
Thanks all. If you're still on, I've recorded both sessions and we'll send them to the media team to get out to you guys. Everyone have a good day.
Thank you.
Thanks, Amanda.